A new legislator is sworn in to the upper chamber. The White House misses a deadline to nominate a new CDC director. And we await the impending release of the President's fiscal year 2027 budget request. For the week of March 30th, 2026, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Revolutionaries in the classroom and have a Health and Human Services that is trying to trans our kids through the grant programs and has research programs at NIH that is funding gain-of-function research that contributed to the last pandemic. You have something that is fundamentally wrong in this country, and we want to make sure that the Congress knows the extent to which we have concerns with many of these programs and agencies, and it's going to finally require...
Kicking off this week's episode with news from the Trump administration, where the White House is expected to send President Trump's fiscal year 2027 budget request to Congress on April 3rd, which will outline the administration's spending and policy priorities for the fiscal year beginning on October 1st. The budget is being released several weeks after the statutory deadline in early February. The proposals are expected to include cuts to federal health programs, including a potential 20% reduction in funding for the National Institutes of Health, as well as requests to restructure or consolidate parts of the agency. Similar proposals in the fiscal year 2026 budget were rejected by Congress. While the president's budget is not binding and Congress is not required to adopt its proposals, lawmakers typically use it as a guide on setting funding levels and policy priorities for federal agencies.
Since my removal, several explanations have been offered. That I told the secretary I would resign, that I was not aligned with the administration priorities, or that I was untrustworthy. None of those reflect what actually happened.
The Trump administration did not submit a nominee to lead the Centers for Disease Control and Prevention by the March 25th deadline required under federal law for acting officials. As a result, Dr. Jay Bhattacharya will continue to oversee the agency without the formal acting director title. Under the Federal Vacancies Reform Act, acting officials may serve for a limited period, after which the administration must nominate a permanent replacement or adjust leadership responsibilities. Without a confirmed or acting director, certain non-delegable authorities, such as approving vaccine recommendations, may be limited or require action by senior leadership at the U.S. Department of Health and Human Services. The White House has indicated it's continuing to evaluate candidates for the position, though no timeline has been announced for a formal nomination. Shifting to news from Capitol Hill today, where on Friday, Republican leadership of the House Judiciary Committee released an interim staff report titled Medical Mismatch: How a Residency Hiring Monopoly Harms Patients, Doctors, and the American People, concluding that the National Resident Matching Program's monopolistic power would normally face scrutiny under Section 1 of the Sherman Act, but has been shielded since Congress granted it antitrust exemption in 2004. The committee further notes that Congress has the power to repeal it. The report is the product of an investigation opened more than a year ago, and the committee plans to continue its oversight work in this area. Earlier this Congress, the Restoring Rights of Medical Residents Act was reintroduced and seeks to strike that antitrust exemption. Also, the Subcommittee on the Administrative State, Regulatory Reform, and Antitrust held a hearing last year titled The Match Monopoly, evaluating the medical residency antitrust exemption. More news today, where Senate Health, Education, Labor, and Pensions, or HELP Committee Chairman Bill Cassidy, a Republican physician from Louisiana, is continuing his investigative work into the promotion of puberty blockers, cross-sex hormones, and irreversible gender transition surgeries on minors. Senator Cassidy sent letters to the American Academy of Pediatrics and the Endocrine Society last week regarding their engagement with the World Professional Association for Transgender Health around age limitations on gender surgeries for children. The letter reads, quote, "As a physician and a chairman of the Senate Help Committee, I am deeply committed to ensuring transparency and accountability in matters related to public health." It goes on to say, quote, "Americans have every right to know the scientific rigor supporting guidelines issued by your organization, particularly given that these guidelines are widely used and relied upon by physicians and healthcare providers and patients, including minors." Unquote. Lawmakers last week advanced several bills aimed at addressing and mitigating illicit drug use across the nation. The Senate passed Tyler's Law via unanimous consent on Monday. The bipartisan bill would require the U.S. Department of Health and Human Services to study fentanyl testing rates in hospital emergency departments and to issue guidance on the incorporation of fentanyl exposure screening into ER drug testing. Companion legislation in the House of Representatives was considered during a legislative hearing before the Energy and Commerce Committee on Thursday. The Senate Judiciary Committee advanced the Combating Illicit Xylazine Act on Thursday in a 19-3 vote. The bipartisan bill would classify the Food and Drug Administration approved animal tranquilizer and non-opioid sedative xylazine, also known as tranq, as a Schedule III substance, while protecting the legal use of the drug in veterinary medicine and agriculture. The House version of the bill was also a focus of the Energy and Commerce Committee's legislative hearing. A group of Republican senators are opening an investigation into whether Mifepristone manufacturers are complying with the Food and Drug Administration's Risk Evaluation and Mitigation Strategy, or REMS, requirements. Senators Bill Cassidy, a Republican physician from Louisiana, Steve Daines, a Republican from Montana, Lindsey Graham, a Republican from South Carolina, Cindy Hyde-Smith, a Republican from Mississippi, and James Lankford, a Republican from Oklahoma, sent letters to 3 Mifepristone manufacturers and the FDA, asserting that it's unclear how the manufacturers, quote, "ensure that prescribers and pharmacies comply with the few remaining REMS requirements, especially when pills are sold online and without the in-person oversight of a medical professional," unquote. The senators urged the FDA to act within its existing authorities to immediately reinstate an in-person dispensing requirement and the requirement for manufacturers to report non-fatal adverse events to the FDA.
Too powerful, the incentives, they're malaligned. The whole thing's too complicated.
This administration rejects that mindset. We take on the broken systems, we challenge the entrenched interests, and we fix misaligned incentives to deliver real results, while bringing together the top talent to take on the toughest challenges head on.
And that's why today we are announcing the members of our new Healthcare Advisory Committee, which will develop recommendations for how Secretary Kennedy and I can improve Medicare, Medicaid, the Children's
On Thursday,
Health Insurance Program,
HHS and the Centers for Medicare and Medicaid Services announced the 18 members of the new Healthcare Advisory Committee, intended to guide federal health policy under HHS Secretary Robert F. Kennedy Jr. and CMS Administrator Dr. Mehmet Oz. The department chose the members following a review of over 400 nominations. The panel will advise HHS and CMS on improvements to financing and delivery across Medicare, Medicaid, CHIP, and the health insurance marketplace. The committee is empowered to make non-binding policy recommendations to transition the system from reactive, quote-unquote, sick care toward preventive health management. Specific areas of focus include developing methods to prevent and manage chronic disease, advancing accountability for safety outcomes while reducing administrative burdens, and expanding real-time data usage to improve claims processing and quality measurement. The committee will also consider strategies to enhance care for vulnerable populations served by Medicaid and strengthen Medicare Advantage sustainability through modernized risk adjustment. Members of the committee will serve 2-year terms with regular meetings open to the public, consistent with federal transparency requirements. A full list of the committee's membership can be found in our weekly written health policy briefing under the news section of our website at www.hhs.com.
incredibly proud now to announce that my pick as the next U.S. Senator of the state of Oklahoma is Mr. Alan Armstrong.
On Tuesday, Senator Marquayne Mullen, a Republican from Oklahoma, was sworn in as Secretary of Homeland Security. Mullen was confirmed by the Senate on Monday in a bipartisan 54-45 vote. Democratic senators voting in favor of the confirmation included John Fetterman, a Democrat from Pennsylvania, and Martin Heinrich, a Democrat from New Mexico. Oklahoma Governor Kevin Stitt, a Republican who you just heard, appointed Energy Executive Alan Armstrong to fill the vacancy for Mullen's Senate seat. Armstrong previously served as the executive chairman of Williams Companies, an energy infrastructure company where he worked for nearly 40 years. Armstrong was sworn into the Senate on Tuesday and will serve on the Senate Help and Indian Affairs committees. Under Oklahoma law, an individual appointed by the governor to fill a vacancy in the U.S. Senate must pledge to not run for re-election at the conclusion of the current term. Representative Kevin Hern, a Republican from Oklahoma and a member of the House Ways and Means Committee, has joined a crowded field of candidates from both parties, running to serve in the seat for the next full term that begins in January.
There's not very many members of Congress get to leave on their terms and their timeline, and so I kind of took the opportunity to do that and now turn it over to whoever the
Final
next
news today, where Representative Sam Graves, a Republican from Missouri, who chairs the House Transportation Committee and serves on the House Armed Services Committee, announced on Friday that he'll retire from Congress. Graves was first elected to federal office in 2001. In related news, special elections to fill seats vacated by Marjorie Taylor Greene and Mikey Sherrill will take place in Georgia on April 7th and New Jersey on April 16th. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.